Hi, it's Dr. Juwan from Total Health and Wellness Center. What we have right here, we have Bryn, who is 17 years old, and she is a phenomenal pitcher. And she just had a really good game yesterday, but the problem is she threw her shoulder out. Did you have a good game yesterday?
Yeah, we won
Awesome, cool. All right, and when's your next game?
tomorrow night.
Okay, so we have 24 hours to make her better. Now, what happens is she rolled her shoulder forward, which she subluxated her biceps tendon. Okay, now this is very, very common in athletes or anybody who the mechanism of action is what she did, she caused enough laxity in the bicep tendon, which goes through a groove called the interdipicular groove, caused enough laxity to roll it out. Okay, in her instance, she pitched. Okay, so the bicep tendon, it's much like a hot dog through a bun, I always say, because here's the bicep tendon, here's the interdipicular groove of the shoulder area. And so what happens is when you roll it 9 times out of 10, you're going to roll it medially. I've been doing this for 13 years and I rarely ever have seen anybody roll it laterally. Most of the times they'll roll it medially, okay? And what that does is you can see here her posture, her shoulder is rolled anteriorly forward. Because what happens is that the shunt muscles in the back, the supraspinatus and the infraspinatus, the shunt muscles, they act to stabilize the shoulder girdle in of itself. So what happens is that she has too much activation of her flexor muscles in the anterior compartment, which will give, does that hurt?
Yes.
Okay. When you palpate the pec minor, yeah, you can see it hurts, yes. And again, if I palpate the bicep, yeah, you can see right here, she's wincing right here. Also here, the bicep brachioradialis, yeah, so you can see her wincing here, as well as the eccentric carpi radialis. Reason being is because the radial nerve, which innervates all the extensor muscles, it's being impinged here because of increased flexor tone. Okay, so let's just do some muscle testing. Look right here, lock your shoulder out. Okay, and I'm gonna push down. Yeah, see how that's weak? Okay, and then hold your hand up like this. Okay, okay, you see that weakness there. Okay, now let's just do an orthopedic test. Let's have your hand out like this. Okay, look right here. I'm going to palpate, again, I'll palpate the bicep tendon and I'll have her internally rotate while I push against it. And see, you can even see her, she's wincing. Just for comparison, you can see on the opposite side, I could poke and she's fine. Okay, there's no muscle strength, there's no muscle loss of strength. Also too, she's not even wincing, she's in smiling. Okay, so the goal is to roll the bicep tendon back in the groove, activate the posterior shunt muscles for stabilization of the front muscles. Again, it's kind of like what I want to do is I want to activate her tricep to stabilize the bicep. So let's get you on the table. Okay, good. So again, I'm just going to show you again, just now that I took her gravity muscles out of play, now she's laying down, you can see even more, put your hand like this, you can even see even more how she's weak, okay? Okay, see that she's very, very weak. Now, what I first want to do, actually let's do this one. Here, let me push down, don't let me win, hold it tight. Okay, yeah, so that's even, now it's even more, it's weaker because I just took her gravity muscles out. Okay, so what I want to do, first and foremost, I always start off with the bicep, where right here where the, where the extensor carpi radialis is and the brachioradialis muscle is, because again, it's tight, so she has an impingement of the radial nerve. So I just want to do some gentle like ART, okay? And I know this, I always say this, if it doesn't hurt, we're not doing it right. Okay, so this is bitey. Okay, you can see that she's wincing. I know it doesn't feel good. There you go. Okay. Also, too, I want to make an adjustment to activate some afferent information to that cerebellum. Good. Good. All right. I also want to adjust the wrist. Again, when I'm focusing on all the extensor muscles. My goal is to activate the right cerebellum, which feeds into the left cortex, which the feedback loop is going to enhance her motor function down to her arm. Now again, she's a pitcher, so it's just a big game tomorrow night, so I have a lot of pressure on me. You see that? Yeah, beautiful. Okay, so I get that. So this is where it comes in tricky. So my goal is I want to roll the bicep tendon back in the groove. And I always say this, if it doesn't hurt, we're not doing it right. Okay, so what I want to do, I anchor the bicep tendon with my thumb. Now again, remember the bicep tendon rolled anteriorly to the intertrabecular groove. So I'm going to anchor the bicep tendon. You can see she's wincing. I know, and I would just say, give me a nice 4 count. Ready, here we go. I want to roll the shoulder down. And there we go. Okay, I usually go about 3 rotations. And what we're going to hear, sometimes we'll hear like a nice clunk. Good. Let's do it one more time. I know it doesn't feel good, I know. Okay, good. Now we heard. Okay, you hear that?
Yeah.
Okay, good. Now as she heard it, it's in. So I also want to do a long axis extension of her shoulder to activate that part. Adjust her shoulder, posterior anterior adjustment. Again, my whole goal is to activate those posterior shunt muscles. Good. All right. I want to also, if you go over here, I'm going to adjust her neck. Now, I want you to look to the upper right-hand corner of your eyelids. Doing that, so what I'm doing, I'm activating the right cerebellum, which again is activating the right extensor muscles. Very beautiful. Okay, I'm also going to do the left side more so on the lower end to create the monosynaptic reflex. Good, beautiful. All right. Let's get you on your stomach. Okay, I'm also going to, again, I want to adjust the mid-spine as well. Give me a deep breath. Blow it out. Good, good, good. Good, good. Keep your head up. Look up. Good, super. All right. Let's have you sit up. Okay, so now, beautiful. How do you feel?
I feel great.
Awesome. Okay, first and foremost, the thing I like about this adjustment, the results are immediate. First and foremost, after the adjustment, what I usually assess first and foremost is look at the shoulders. Now her shoulders, she's able to roll her shoulders back. Why? Because what I'm doing, I'm taking the pressure off the flexor group. I'm activating, again, the posterior shunt muscles, the supraspinatus and the infraspinatus. Those muscles, when they're activated, it is going to draw the shoulders back. When it's not activated, it's going to roll the shoulders forward. But now she's rolling it back. You can see it right here. So I always palpate both shoulders. Also, you want to do a muscle test? Look right here. Okay, you can see she's tight as, yeah, beautiful. Let's do the extensors. Lock your elbow. You can see even right there, she's stronger than before. Okay, let's do the Jurgensen's test. Look right here. Now remember, push against me on the inside. Good. See, look at no pain.
None.
No pain whatsoever. Again, let's do this side. That feels the same, right?
Yes.
Beautiful. Okay, so again, what I do for therapy, for physical therapy, what I always tell my patients to focus on is to focus on the posterior group muscles. Okay, so this is the flexor group, this is the extensor group. Any type of exercise or physical therapy exercise that's going to work on the posterior delt muscle, the supraspinatus muscle, infraspinatus muscle, as well as the serratus anterior muscle, because all those muscles in the posterior group, as well as the subscapularis muscle, because those muscles working together are going to help stabilize the shoulder. Okay, and once you stabilize the shoulder, it lessens the chance of it rolling back out. Now again, she's a pitcher. She has a big game tomorrow night, so the pressure was on me to fix her immediately, and usually it does. Usually it'll take about maybe 1 or 2, maybe even 3 treatments, but the key thing is to focus on physical therapy exercises to work on the posterior group muscles. All right, so I hope you liked the video. How are you feeling?
Great, thank you.
Awesome, good luck tomorrow.
Thank you.
Okay, perfect. Thank you.